Congratulations from this government about how their budget stabilizes frontline services in healthcare and education. Budgets for those ministries are certainly robust, but like all plans, the devil is in the details. One healthcare executive I met at a breakfast this morning told me we don't have a budget problem so much as an allocation problem. To the health minister, how are you working to ensure that the dollars allocated for healthcare are going to the areas where they are most needed?
Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the important question. Certainly wanting to reduce the expenditures from what we've seen historically being about 6% down to 3% this year is certainly a great challenge, but it's something that we're certainly up to the task. And part of that is making sure that we have ongoing dialogue, that we're making sure that we're allocating to the right areas. We're focusing on community initiatives like addressing midwifery wait lists by expanding by 400 courses of care every year over 4 years. That's a significant increase, Mr. Speaker. We meet regularly with Alberta Health Services, and I was at the same breakfast and happy to meet with some of the stakeholders to address their concerns in person.
First supplementary.
Mr. Speaker, given that frontline workers can often provide the best guidance on areas of neglect and wastefulness, again to the health minister, what does that dialogue with frontline workers look like? And because they're watching, when we ask them, will they tell us that they've been consulted by your government?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. Certainly I've met many times with folks at ACCA, as was one of the organizations that hosted this morning. The work that they're doing to make sure that our seniors have the respect and dignity that they deserve, as well as others who might have disabilities who need supports to age in place in community, I would say rather, is certainly an important priority for our government. We are regularly in dialogue with frontline stakeholders, with local community leaders, and of course one of our biggest partners being Alberta Health Services, which is has the responsibility of delivering the actual frontline care. I met with them yesterday and I'll be meeting with them again today.
Just second supplement.
Thank you, Mr. Speaker. And finally, to our Minister of Finance, given that the cumulative deficit over the next 3 years is a jaw-dropping $28.9 billion, and given that no substantial new forms of revenue are being sought out, are you prepared to tell frontline workers in healthcare and education that their long-term job security fears are unwarranted?
Minister of Finance.
Thank you very much. You know, the long term, this government is committed to continuing to fund education, health services, human services. We are going to make sure that the people who are doing frontline work are not put at risk as previous government would have done and as the opposition would do.